Inflammation is a term I personally don't like because it's got such a protean presentation. It can be so varied. So you might have a rash, you might have psoriasis, you might have flaky skin, you might have an aching joint, an aching big toe, an aching knee. You might be depressed, and in a lot of cases, depression and anxiety can be consequent to inflammation. You might have abdominal pain. It really can manifest in any number of ways. So I think it's much better to just say it's the absence of inflammation, which is actually what defines good health. The simple fact is that we've got a couple of blood tests where we actually can measure, and they're very crude measures of inflammation. They're what we call sensitive, but not specific. What that means is that if you are inflamed, these markers will likely be out of whack. But if they're out of whack, it won't tell you where the source of inflammation is. It could have been a cold that you got 2 days ago. You could have broken your toe. You could have a rash, what have you. So they're very imprecise. But one of these markers is called C-Reactive Protein. And when we actually look at people's longevity versus their C-reactive protein, we find that the people with the very highest levels do incredibly poorly. And the interesting thing about this is that the normal reference range on the blood tests actually is usually between 0 and 5, when we've actually got very, very good research that anything over 1 and probably over half is actually associated with early mortality. So I guess in terms of how can we present, well, if you're not feeling 100%, there's a very good chance that you are carrying inflammation of some sort. You know, that could be autoimmune inflammation, where your immune system is attacking you. That could be an infection, your body responding to an infection. That could be something like a cancer. It could be a physical trauma where you've sprained your ankle. There's multiple ways that you can sustain inflammation. The problem is, though, that once you are inflamed, you're in a far worse state of health, and there's only one solution, and that's to try and improve it. And don't trust the standard reference range on bloods, because that is not set based on what is optimal for your health. When your doctor looks at that and says, oh, your CRP is 3, well done, because it's under the 5 that the flag post is set, that is not a marker of good health. So that's set based on 95% of the population. If you walk around the shops now, you can see that 95% of the population is unhealthy rather than being healthy. And we're using 95% of the population to determine what inflammatory goals we should aim for on bloods. That's just crazy. Basically, look, if you have pain, you're probably inflamed. If you have a defect in your skin, you're probably inflamed. We're now understanding this concept of what we call neural inflammation, whereas we know mental conditions such as schizophrenia, bipolar disease, severe depression, anxiety, these are associated with inflammation of the nervous system. So if you're not in optimal health, you're going to be inflamed.